Welcome to your Employee Benefits Overview video provided by 208 Benefits. The information provided in this video is to help you understand your benefit options, pricing, and how to complete your benefit elections prior to your benefit eligible date. Please watch or share this video with anyone that helps you make your employee benefit decisions for you and your family. You can refer back to this video at any time. First, let's review your benefits and then walk you through the features of your benefit information website. Thrive provides a comprehensive benefit package that includes medical insurance, comprehensive telehealth, short-term disability, accident injury insurance, term life, critical illness insurance, dental, and vision. Your medical insurance options are through Regions Blue Shield of Idaho. Before we review the plan options, we want to review medical insurance terms you should know. Copay, a fixed dollar amount that you pay for a doctor's visit or to fill a prescription. Deductible, it's the amount you pay for eligible healthcare services before your health insurance begins to pay portions of costs such as hospitalization, surgery, and diagnostic exams. Coinsurance. This is the percentage of eligible healthcare expenses that is split between you and the insurance after your calendar year deductible has been met. Out-of-pocket limit can be also referred to as out-of-pocket maximum. This is the maximum you pay in a calendar year for eligible healthcare expenses. This includes your deductible, co-pays paid after the deductible, and coinsurance. Once the out-of-pocket limit is met, the insurer pays 100% of all eligible healthcare expenses incurred in the calendar year. Health savings account. This is a type of savings account that lets you set aside money on a pre-tax basis to pay for qualified health care expenses such as deductibles, co-payments, co-insurance, prescriptions, and more. This plan type does not cover any health care expense except preventive services before the deductible is met. HSA funds, money that you put into the account through payroll deductions, are 100% owned by you, the employee. They roll over year to year, earn interest, and can be invested for retirement savings. You must be enrolled in an HSA eligible medical insurance plan to set up a health savings account. Preventive examinations. All plans include preventive examinations at no cost to you. These are specific medical exams, also referred to as wellness exams. Here's a list of wellness exams that are included. Please review your plan summary for further details. Regions provides 3 network provider options. St. Luke's Health Partners, which includes St. Luke's, Primary Health, and Salzer Medical Groups. Regions Accord Network, which includes St. Alphonsus and Valor Health. And the Regions PPO, which includes the first 2 networks plus a nationwide Blue network. Here are the 5 plans currently available to Thrive employees and their families. As you'll see here, we identify the network, St. Luke's Health Partners, Regions PPO, Regions Accord. We identify the plan type, copay first or deductible first, and whether it's an HSA eligible plan, yes or no. Here you'll see the deductibles that are ranging for each plan, the coinsurance amount, the out-of-pocket maximum, cost for doctor's visits, and prescription drug coverage. Please refer to your benefit summary for further details on the prescription drug coverage and all the other benefits each plan does provide. Employee Assistance Program is also part of your Regions plan. When you enroll in one of the options above, you'll be able to also take advantage of the additional support that the Employee Assistance Program offers, including confidential counseling, crisis help, peer support groups, and additional services. Member wellness incentives. Within the first 4 months of you being enrolled in your plan, you have the opportunity to earn a $100 e-gift card by simply taking 3 steps. Completing an online health assessment. This is through your Regions.com portal. Complete a biometric screen. You can present in person to Quest Diagnosis or request an at-home test kit. Once those 2 have been completed, you simply redeem your points to earn that e-gift card and use that $100 however you see fit. The next benefit as part of your benefit package is telehealth. This is through HealthyAsYou by Teladoc. Now, the employer provides this for all full-time employees and dependents, regardless of whether you're enrolled in the medical insurance plan. Telehealth allows you to talk to a doctor 24/7 using the mobile app, online access. You can also talk to specialists for medical advice, receive a second opinion. Confidential counseling, you can talk to a therapist 7 days a week from wherever you are. Back care, dermatology are also included. Great news for you is that all these doctor's visits are at no additional cost to you. There are no copays, you will receive no bill. You simply use the platform as appropriate as you need to, and then again, it is there for you and your entire family. Prescription savings plan. This is separate from your medical insurance plan. We want to make sure that you do not overspend on any medications that you may have to take on a temporary basis or maybe even a long-term basis. So we have a partner that allows us to help you unlock exclusive savings that'll provide up to 80% off prescription drug costs. You simply download the mobile app, type or speak your prescription name into the app, see the list of pharmacies for the nearest savings, select your pharmacy based on whether it's convenient, preferred pharmacy, or the best savings, and simply present the voucher to the pharmacist. As an example, 40% of generic prescriptions using our app are less than $10. If you refer to your medical insurance plan copays, a majority of the copays for generic drugs are $20 or higher, so obviously this is a great way to save more than 50% off your generic prescriptions. Our advice is just check with the app first before making your prescription drug purchase and to make sure that you get the best cost. Short-term disability is the next benefit in your benefit package. Short-term disability is basically protecting your income if you're unable to do work due to an off-the-job injury, illness, or maternity event. Here are the benefit details. The income benefit is based off of your gross monthly earnings. This is not your take-home pay, this is the total of your pay before taxes, and the income benefit pays 60% of your gross monthly earnings on a weekly basis. The benefits are payable after 14 calendar days, meaning that the first 14 calendar days is, in a sense, a deductible. You cover yourself for the first 14 calendar days with paid time off, sick leave, or savings, and then on the 15th day, your benefits begin. The benefit duration is 24 weeks per disability event for off-the-job injury or illness. If it is a maternity disability, the benefit duration is 6 weeks for a normal delivery and 8 weeks for a C-section delivery, less the 14-day disability deductible. So here's some examples of how these benefits are payable based on the average employee benefit amount. So if you were out of work due to an illness for 5 weeks, your benefit payable would be a weekly benefit of roughly $634, totaling in just over $1,900. On another example, if you had a lower leg injury and you were out of work for 9 weeks, as an example, your weekly disability benefit would be paid to you, and the total for that period of time would be over $4,400. Now, do note, every employee has their own specific weekly disability benefit that is based on their gross monthly earnings. So when you enter the enrollment platform to select your benefits, you will see in that enrollment platform the exact weekly benefit that is applicable for you at the time of this video. Life insurance. This is an employer-paid life insurance benefit that provides each full-time employee a $10,000 benefit payable to their beneficiaries. Accident insurance. Accidents happen, so we want to make sure that if they do, that you have a benefit policy that's going to pay you a fixed cash benefit amount for the diagnosis of a specific injury. Benefits are not impacted by your medical insurance coverage or any other insurance covering the injury. Basically, the policy is going to pay its benefits directly to you regardless of other insurance in place. Here's an example of some benefit amounts payable. If you or someone covered by your policy has an upper arm fracture or a lower leg fracture, surgical repair would provide the following benefits. And if it's a non-surgical repair, you'll see that the benefits are a little bit lower here for that. But as an example, again, if someone in your family experienced a lower leg fracture, it required a surgical repair to fix, there would be a $5,000 benefit payable to help you offset your medical expenses, your everyday living expenses, etc. Here's just a quick snapshot of the potential of the other types of benefits that can be payable for the other types of fractures, internal injuries, tendon, ligament dislocations, etc. Optional term life insurance. Referring back, your employer does provide a $10,000 benefit for every full-time employee. However, employees can increase their life insurance coverage through a simple payroll deduction. Employees can elect anywhere from $10,000 to $100,000 in coverage, can add the spouse up to $20,000 in coverage, and $10,000 coverage per child. When you enter your enrollment platform, you'll receive this option, and you simply select it through the drop-down menu options, the amount of coverage that you're looking for, and then the cost will appear in the shopping cart, and then you select the coverage that's appropriate for you. Critical illness insurance. Much like the accident policy, it's designed to pay a fixed cash benefit amount for the diagnosis of a specific serious illness experienced by you or anybody covered by your policy. Again, benefits are payable regardless of any insurance in place. Covered illnesses include heart attack, invasive cancer, stroke, and a whole list of other diseases that you'll see here on your screen, but also please refer to your benefit summary for a full benefit disclosure. You choose the amount that's right for you. The starting amount is $5,000. You can increase up to $10,000 and even further up to $15,000. You can add your spouse. They receive 50% of the benefit amount that you elect if they were to be diagnosed with one of the covered illnesses. You can add your children. They receive 25% of your elected amount if they were to be diagnosed with any of the covered illnesses. Please note that you can add your children at no additional cost. So we do recommend, regardless of the amount that you choose, please make sure you click the enroll button for your children so that that coverage is available, and again, at no cost to you. Dental insurance. Your dental benefit summary provides you an annual benefit of $1,000 per member enrolled. So if you have a family of 5, every person that is enrolled in your policy receives that annual benefit maximum of $1,000. That maximum does reset at the calendar year. So come January 1st, every member receives a brand new $1,000 benefit. Preventive services. When using in-network providers, you pay 0%, $0, for routine exams, cleanings, x-rays. This plan does have an annual deductible. It's $50 per member, or a maximum of $150 per family. So again, if you have 5 members in your family and everybody goes in to have services that the deductible applies to, you're not paying $50 per member, you're only paying a maximum of $150 per family. Basic services, which includes fillings and sealants, root canals, extractions, oral surgery, your plan is covering 80% after deductible, you pay 20%. Major services, after deductible, your plan covers at 50%. This includes crowns, bridges, dentures. Please see the full benefit summary for all your benefit details of in-network and out-of-network coverage. Vision insurance. The Vision Plan network is through VSP, which provides you a host of in-network independent eye doctors, but also top optical retailers, including Pearl Vision, VisionWorks. Intermountain Eye Center is a local Idaho-based provider. And then you also have Iconic, which is an online provider. Your benefit summary. Eye exams is a $10 copay. Your lenses and frames, $25 copay for lenses, $150 allowance for your frames. You have lens options available. You have copays and discounts for UV treatment, tinting, scratch coating, etc. Your benefit frequency. Basically, how often can you use your benefits? Benefit frequency is every 12 months based on the initial access date of using your benefits. For example, if you purchase your policy when your benefit eligible January 1st, but you waited till April 15th to go and have an eye exam and purchase new lenses and frames, you are eligible to use your benefits again April 15th or after the following year. So that is the 12-month benefit period. Your next steps. Review your new benefit information. We'll show you exactly where to find that. Contact our office with any questions. Complete your benefit elections online. This part of the discussion basically walks you through the employee benefit information website. So this is for ThriveWeb Design specifically, and as you see here, there are some basic instructions of what each tab below, what they provide, and how you can navigate them. So as you scroll down here, you can see that there are the View Benefits tab with interactive tiles. Each of these tiles will provide you more information regarding that specific benefit. As an example, simply click on your health insurance plan benefit and you will see your group number, the insurer, contact information, member login to the insurer specifically. So when you do enroll, you'll be able to access more detailed personal information regarding your plan usage, etc., your explanation of benefits, all through that member login. There's video here that helps you understand how to use the member login, the mobile app. Down below you'll see here PDFs that give you additional information. There is a member guide on how to best utilize your region's health plan, and then there are summaries of each of the plans available. So you can review each of the plans by clicking on the summaries here. And then for future reference, you can come back to this website at any time and pull up this plan summary. Provider search, prescription coverage search, and a prescription drug list of all covered prescriptions is right here for you as well. You can review the benefits here of your comprehensive Teladoc benefit. You can move forward to each of the benefits options with the toggle buttons down below, watch the video, download the mobile apps, use our group number and ID number to get your prescription savings plan set up. Every benefit again is right here for you. So in the event that you do have, as an example, a short-term disability claim, you can look at the benefit summary and then you can simply click Start Disability Claim right here. It'll take you directly to the insurer's website and just follow the prompts. You're the employee, simple consent, and then follow the steps on how to set up that disability claim. So again, just taking you through each benefit that's available here for you. You can review your benefit pricing. You'll see here there is a pricing per the benefit plan that you're electing. When you're enrolled in benefits, you simply ready to enroll. There is a video here that can show you how to walk through the online platform. It takes you step by step. And then when you are ready to enroll by the 15th of the month prior to your benefits eligible date, just simply click Go to Benefits. This will take you to your login. Your email address is your username. If you are new and you have not set up a password, or if you forgot your password, it's pretty simple. Just click Forgot Password either way. Enter in the email address and then click Submit. If you do not receive an email reset or a creation email link within about 5 minutes of doing this, please refer to your office manager or HR person to verify that the email address that you are using is the email address in the benefit admin platform, so that we can correct that and make sure you can have access. Once you are completed, your benefits will be processed and sent to the insurers, and you will be set up for the first of the month of your benefits eligibility date. If you have any questions, please reach out to our office or reach out to your benefits contact. Thank you again. And just a reminder to complete your benefits the 15th of the month prior to the benefits eligible date.